Hello, everybody. My name is Dr. Oksana Suchowersky, and it's my pleasure today to talk to you about what to start and when to start treatment when you've just been diagnosed with Parkinson's disease. Just as a reminder, Parkinsonism refers to slowness or bradykinesia, stiffness or rigidity, and a tremor, which are the hallmarks of the motor features of Parkinson's disease. But there are many causes of Parkinsonism, one of the most common being Parkinson's disease, which is diagnosed clinically using specific criteria. So the first step in treatment is to making sure that the diagnosis is confirmed by a neurologist and it's not one of the other causes of Parkinsonism, as the treatment will vary. Now, once you've been diagnosed with Parkinson's disease, should you start treatment? Well, first, what is the level of disability? If you have difficulty walking, if you have a lot of stiffness and slowness, maybe causing pain, if you're not able to write or perform activities of daily living, then I think it's quite clear you should start treatment. But if your symptoms are mild, for example, if they affect your non-dominant side, if you only have a little bit of stiffness or decreased arm swing, then maybe you don't need to start treatment at that time. What is the most disabling symptom? Is it a bit of a tremor, which you may be able to deal with, or is it that the shaking is so bad that you can't hold a pen or wash your hair? How about your employment? Are you still working full time? Are the symptoms interfering with your ability to work? Is it interfering with your activities that you enjoy doing? For example, your social activities. Do you like to play pickleball or golf and you find that you can't do that very well anymore? So all these factors need to be discussed with your treating physician to come to a decision on whether you should start treatment. And if that decision is made, what are the choices? So first of all, we need to understand that treatment of Parkinson's disease is to replace the dopamine, which is not present anymore or not being made very efficiently in the brain. So on the left-hand side of the screen are the medications that have some benefit but are not the so they, first of all, starting with the MAOB inhibitors, such as rasagiline and selegiline. These increase the level of dopamine in the brain by decreasing the enzyme that metabolizes dopamine. The anticholinergics work on another chemical called acetylcholine. So in the brain, there's a ratio between dopamine and acetylcholine. And in Parkinson's, as the dopamine level falls, there is a relative excess of acetylcholine, and the anticholinergics bring it down to balance it. Amantadine, also an old drug that works similar to the anticholinergics. The more effective drugs are on the right-hand side. Dopamine agonists such as pramipexole and ropinirole are taken by mouth, and rotigotine is a patch which you put on, say, an arm or your abdomen in the morning and take it off at night with a constant release being provided. The dopamine agonists mimic the action of dopamine in the brain. So they stimulate the same receptors that dopamine would, but they are an artificial medication. The best treatment is the levodopa preparations. There you see levodopa carbidopa, which is called Sinemet, or levodopa benserazide, which is called Matapar or Prolopa. And levodopa, when you take it in a pill form, is metabolized to dopamine in the body. Now, when it's metabolized to dopamine, it can't get into the brain. It can't cross the blood-brain barrier anymore. So we need to keep the levodopa from being metabolized, and that's what the carbidopa and benserazide do, is they stop the metabolism of levodopa. Now, both of these medications come in short-acting or long-acting forms, but really the short-acting form you can take 3 times a day with meals, which is easy to remember. And the levodopa, once it gets into the brain and it gets made into dopamine, is stored by the nerve cells there and can be used quite physiologically. So we don't really need to use the long-acting form typically, except maybe sometimes if you do get some stiffness or slowness during the night, the long-acting form might then. So of these agents, which should you start with? Again, you need to look at the level of disability. Are your symptoms severe enough where they're interfering with the activities that you need to do? Are they interfering with the activities that you'd like to do? And what about your age? Now, if you're young and have a prominent tremor, then you may consider the anticholinergics. But remember, they lower the level of acetylcholine, which is what is needed for short-term memory. So generally, we don't use anticholinergics in older patients because of the memory side effect. Otherwise, the rest of the medications typically are used across all age ranges and generally work quite well. Now, cost needs to be considered, and in some of the older drugs, such as amantadine, selegiline, are quite inexpensive and are generic. The dopamine agonists are more expensive, particularly retigatine, which would not be generic as yet. Levodopa generally is available as a generic formulation and should not be very costly. But you need to check with your insurance plan to determine if costs are a factor. The side effect profile we're going to deal with next, but just as a reminder, levodopa is by far the most effective medication for all symptoms of Parkinson's disease and is effective throughout the duration of the condition. Less effective, but still will help all symptoms, are the dopamine agonists, but they have more side effects than levodopa. And the least effective are the MAOB inhibitors, amantadine, and cholinergics, which with a benefit of only maybe 6 months, at most 12 months before another medication needs to be added. And of course, all these medications we can use in combination in more advanced Parkinson's. Let's talk about side effects now. So the most common side effect with the dopamine agonists and levodopa is nausea. It's seen in about a third of patients, and that's why I always start with a very low dose to be slowly titrated up to the therapeutic dose within a few weeks to a few months even. If you take it on a full stomach, that helps with the nausea. And in the early stages, Sinemet is absorbed well, even if you take it on a full stomach, so you don't need to worry about that. There are some medications that can be used if the nausea is quite severe, such as ondansetron and others. And please remember that you should not use metoclopramide, which is also known as amaxiran or Reglan, as that can worsen the Parkinson's disease itself. Somnolence is another problem that is not uncommon. Some of these medications will cause daytime drowsiness or excessive daytime sleepiness, and sometimes they may even cause sudden sleep attacks. So for example, people will be driving and will suddenly fall asleep. So that's important to remember and perhaps not drive when you're just starting them. Low blood pressure is another common side effect, and important to check your blood pressure lying and standing to see if you have a postural drop, if you feel dizzy. And in some individuals who have had high blood pressure and are on blood pressure pills, those blood pressure pills need to be decreased or even discontinued because the blood pressure will be lowered by the medications. We do need to talk about impulse control disorders, which is not uncommonly seen with the dopamine agonists, and this means something that you like doing. For example, you might like going to the casino once or twice a year, buying a few lottery tickets, but when you go on a dopamine agonist, you can't control your gambling and you end up gambling online, gambling every day, losing money. There's other impulse control disorders such as excessive shopping, excessive video playing, things like that. So the individual need to be aware of this, the caregiver or the spouse needs to be aware of this, so that this can be monitored. Now, we have lots of choices for these medications, so it is we can always substitute one for another. If you get a side effect with one medication, you may not have it with another. And just like to mention that some people are resistant to starting levodopa, but there is no evidence that starting levodopa for treatment of symptoms increases progression of Parkinson's disease or increases the incidence of dyskinesias, which are the involuntary movements. I mean, that will happen in anyone with Parkinson's disease once they have been on treatment for a number of years. Also, use of levodopa helps us confirm that this is true Parkinson's disease, because anyone with true Parkinson's disease will respond quite well and get good benefit from levodopa. For the last slide, I'd just like to remind you that Parkinson's disease is more than the motor symptoms. It is also has a variety of non-motor symptoms. And you can see 3 listed there, and all 3 of these can begin several years to maybe even a decade before the motor symptoms of Parkinson's come on. So first of all, gastrointestinal symptoms, particularly constipation, can begin and should be looked at, treated. Depression and anxiety can begin a number of years before motor symptoms. Again, we have good medications to treat that. And sleep disorders, particularly acting out your dreams, called REM behavior sleep disorder, which also can occur. Remember that exercise is very important in Parkinson's disease. It is recommended that you exercise at least 30 minutes a day or 60 minutes every other day. Does not matter what type of exercise you do, but you do need to exercise. As the condition progresses, you are at more risk for osteoporosis, so important to take vitamin D and calcium. The amounts can be discussed with your family doctor. And finally, when you start on levodopa, levodopa uses the B vitamins for metabolism. And in people who have been on long-term levodopa use, some of them do get other side effects, such as damage to the nerves in the legs. And so starting B vitamin replacement also can be recommended. Finally, I'd like to remind you that use of the support societies, many of which support the World Parkinson Congress, provide very good support to individuals and families, provide counseling, provide exercise programs, and their use is very helpful in many individuals. So thank you very much for your attention, and I look forward to your questions.